We're going to begin the full body lymphatic detoxification sequence with deep belly breathing, pushing the lower belly up toward the ceiling. Try not to inhale deeply through the chest, but picture your breath being a color and try to visualize pulling that color in through the nose and straight down to the abdomen. If it helps to give you or your client some feedback, you can rest your hand on their belly and encourage them to push your hands up and away from you toward the ceiling. We begin the full body sequence also at the neck, stimulating at the clavicle, working from the outside edge of the clavicle in toward the clavicular fossa. You can vary your hand position if you need to. Then stretching generally on the neck, tracing the SCM from its origin below the ear toward the clavicular fossa. You can sweep generally, or you can break it down into 2 separate stretching strokes if you have the time, working the proximal part of the muscle and then moving distally away from the clavicular fossa. Stretching right under the ear, in and down at about a 45-degree angle toward the clavicular fossa. You can stretch the whole neck generally with a flat hand, slightly curved to get all the lymph nodes in the neck at once. Moving on to the axillary area or the armpit. Try and get your hand flat and complete as large of a stretching circle as you can in and toward the heart. Then we're working the upper quadrant, whatever will drain to that axillary area, in and up toward the axilla. So this is going to be about rib cage and up, just below the breast. If you have permission in your state, you can do breast work, which is also very helpful with cystic breast, or encourage the client to do breast work on their own. They can actually grasp the breast and rotate 5 times toward the corresponding axilla. Really helpful in detoxifying the breast before mammograms and getting more reliable results. To start the arm, we're going to break the arm down into 3 portions, elbow to shoulder. You're going to work anterior and posterior portions before you move distally on the arm. You can do a general sweep from the elbow to the shoulder to begin, and then you're going to do hand placements covering the whole territory, anterior shoulder stretching in and up, stretching strokes up toward the top of the shoulder, relaxation phase down. Remember here we're working proximal to distal. We don't do the whole arm anterior and then the whole arm posterior. We work in and outside before we move down on the arm. Make sure your hand is flat and relaxed, covering as much space on the arm as possible. You want to get as much work done with each stroke as you can. Now working underneath the arm, stretching the skin in and up toward the lymph nodes in the axilla. And again, remember this is a general sequence for a healthy, non-pathological lymphatic system, meaning for detoxification purposes and all medical disorders that are indicated except for lymphedema. We need to have a specific pattern per patient for rerouting for lymphedema patients. So These protocols that you're seeing today would be great for fibromyalgia, chronic fatigue, general swellings due to trauma, orthopedic surgery, and all the other indications except for lymphedema where lymph nodes have been removed. Working out on the forearm, proximal to distal, interior and posterior arm. Make sure you're covering the whole territory, inner and outer arm, before moving on to the hand. We're not going to spend a great deal of time draining the hand itself, but please know if you're seeing a client for pathology of the hand, you can treat the whole hand like a limb itself, working anterior and posterior on the hand, and you can work proximal to distal on each individual finger, treating it as if it's its own limb. You can do 10 to 20 repetitions in each place. Very beneficial for arthritis and minute swellings in the joint. Now we're working our way back distally to proximal, stretching strokes at the hand and wrist, stretching in and up. Try and make sure your rhythm is coinciding with what the lymphatic system does on its own, which is about every 6 seconds. Try and keep it 1, 2, 3, off, 2, 3. Make sure you and your client are taking deep, steady breaths to stay relaxed, not hold any tension, and continue to stimulate the lymphatics in the abdomen. If you're working a specific pathology of the arm, such as carpal tunnel or elbow tendonitis, you can also stimulate with a circular massage the lymph nodes in the front of the elbow, the antecubital lymph nodes. Working up the back of the arm with stretching strokes. Divide the arm up into thirds, more or less if necessary, depending on the size of your client. Remembering to work inner and outer portions of the arm before moving proximally or distally. Just under the axilla, stretching in and up toward the axillary lymph nodes. If you or your client have a hard time reaching this part of your arm, you can use a long or short-handled bath brush to reach the area of the posterior shoulder.